from South Africa via the Kingdom of Eswatini. On behalf of the National Emergency Response Committee on Coronavirus and the Ministry of Health, and indeed on behalf of the many Kenyans, I would like to pass our sincere condolences to the family of the deceased. We have also been informed that a South African national on quarantine in Nakuru has also passed away in circumstances that do not seem related to the disease. This is a police investigation, and further information will be communicated to you upon its completion. We have informed the South African Embassy about the incident through our Foreign Affairs Ministry. Again, on behalf of the National Emergency Response Committee and the Ministry of Health, I would like to convey our condolences to her family through the South African Embassy. I would also like to inform you that there are 2 more patients among the 31 who tested positive for the coronavirus currently admitted in the intensive care unit at Aga Khan Hospital. The 2, both male, one a French national and the other a Kenyan citizen. Together with the medical team at the hospital, we are closely monitoring their treatment and they are behaving well. In the last 24 hours, a total of 156 samples from suspected cases of coronavirus have been tested in various laboratories in Kenya. Fellow Kenyans, all the 156 samples have tested negative for the coronavirus disease. Therefore, the total number of confirmed COVID-19 cases in Kenya remains 31. As I mentioned yesterday, these 31 confirmed cases are spread out in 5 counties, namely Nairobi, Kajiado, Mombasa, Kilifi, and Kwale. Within those 5 counties, Nairobi is leading with 21 cases of those who have so far tested positive, followed by Kilifi with 6, Mombasa 2, while Kajiado and each has 1. Out of the 31 positive cases, 19 are male, while 12 are female. Tracing of contacts for the 31 confirmed cases is ongoing. The total number of close contacts that we have so far identified stand at 1,067. Out of this number, 136 have been discharged after completing the mandatory 14-day follow-up period. Currently, our teams are monitoring some 931 close contacts. We have 5 individuals admitted at Bagathi Hospital waiting test results. To date, we have tested 752 persons for the coronavirus disease. And as I said earlier, do not mistake testing with surveillance. The surveillance exercise has captured thousands of people. We are talking about testing for suspected cases. From this Sunday, March the 29th, 2020, we will embark on mass testing for more than 2,000 persons who arrived in the country from last Sunday, March 22nd, and are currently under mandatory quarantine in various designated hotels and government facilities. This will be done alongside the WHO guidelines on testing for the virus and in accordance with one's arrival date. This exercise will also be extended to all close contacts of confirmed cases who have been monitored for at least 5 days by our contact follow-up teams. As earlier announced by His Excellency the President, from this evening, 7 p.m. to 5 a.m. in the morning, there will be a curfew countrywide. The curfew continues every evening until further notice. The Inspector General of Police, here present, will give details on the operations of the same. The curfew has been necessitated by the fact that it has been very difficult to maintain social distancing. A lot of our people who have been infected is as a result of social interactions and from our own observations, usually in the evenings and at night. Secondly, even where we have asked people to do self-quarantine for the mandatory 14 days, we have observed the habit of social distancing during the day and flaunting it at night. This is unacceptable. We have also noticed, even in public transportation, that the rules are observed during the day and again flaunted in the evening and at night. Further, we have observed that a lot of the people who have the potential as carriers of the disease are fairly young people who also tend to socialize at night. So what we are trying to do is basically curtail social interactions and increase social distancing. And I would like to repeat to my fellow Kenyans that the fact that today, for instance, we did not have any disease announced, any positive announced, is not to say that we relax. If you look at the trend that we have experienced, is that you will notice that now you have got somebody in Embakasi. One of the cases, for example, we noticed is in Embakasi. The case in Malindi, one of the cases in Malindi, has now attracted 122 contacts. The case in Siaya have attracted 138 contacts. The first one is 122, just one person. The second one is 138 people, just one person. And you are all aware of the Korean, I think is number 37, who has so far contacted nearly 5,000 persons, have been infected as a result of that one person. So the minute you know that somebody close to you, somebody in your area, somebody in your estate has been confirmed as positive, you should protect yourself by keeping as much social distance as you can. It is the only way that you can escape the disease. So we keep repeating, social distancing, keep washing your hands, keep sanitizing. This is indeed what is going to help us. I truly want to plead with Kenyans to understand that social distancing, which is actually flaunted largely, is the surest way of cutting the rate of community transmission in the country. I reiterate that the need to be disciplined among our people to cut off transmission, as evidenced in our recent statistics. People must take seriously and observe the Nyumba Kumi initiative by ensuring the precautionary measures we have announced are strictly adhered to. If we do observe these measures, we may just overcome this disease before it gets worse. We appeal to our fellow Kenyans to exercise responsibility and cooperate with the government on this and other measures that we have announced. I thank you very much. Before we take any questions, I would like to invite the Inspector General to make his comments so that we can respond to questions at the same time. Inspector General.
Thank you, Waziri. In pursuance to the announcement by His Excellency the President on 25th of this month about the curfew, followed by the issuance of the Kenya Gazette in line with the Public Order Act, issued by the Cabinet Secretary of Interior, Mr. Dr. Fred Matiang'i, issuing the directive of curfew beginning today, this evening. The National Police Service here outline the following measures which will be enforced with effect from 7 p.m. all the way up to 5 a.m. The curfew applies to the entire territory of the Republic of Kenya. As I've stated, it will take place between 7 p.m. starting from this evening up to 5 a.m. until further notice. It will prohibit all the public gatherings, processions, or movement either alone or as a group during the period of the curfew. The implication of this curfew. The curfew demands that all the persons present within the territory of Kenya shall remain indoors within the said period. This will only exempt 20 essential services which were outlined in the Gazette notice of yesterday. And to be very specific, these are the services: medical professionals and health workers. 2, national security, administration, and coordination of national government officers. 3, public health and sanitation officers in the county governments. 4, licensed pharmaceutical companies, pharmacies, and drug stores. 5, licensed broadcasters and media houses. 6, Kenya Revenue Authority. 7, Kenya Airport Authority and licensed civil aviation service providers. 8, Kenya Civil Aviation Authority. 9, Kenya Airways. 10, Kenya Airport Authority and licensed port operators. 11, power production and distribution companies. 12, water service providers. 13, food and farm produce processors, distributors, dealers, wholesalers, retailers, and transporters. 14, licensed supermarkets, mini markets, and hypermarkets. 15, licensed distributors and retailers of petroleum and oil products and lubricants. 16, licensed telecommunication operators, service providers. 17, licensed banks, financial institutions, and payment of financial services. 18, fire brigade and emergency response services. 19, licensed security firms. And finally, postal and courier services. Consequences for those people will violate the terms of the curfew. Any person who violates the curfew commits an offense and shall be arrested and charged in a court of law. I'd also like to take this opportunity to direct members of the National Police Service who will be in full swing in operation from this evening to raise roadblocks across the country, no movement of motor vehicles. Any movement which is not exempted in the list of the essential services will be detained, and the same will be arraigned in court. Essential services motor vehicles will be subjected to inspection and thorough scrutiny to confirm they are in line with the essential services they are providing. Will also require identification cards from the personnel in the essential services to confirm that they are legitimate and also they are on duty. Any person who violates these regulations will be dealt with accordingly. I call upon the members of public to cooperate with the teams of the National Police Service for us to effect the curfew as it is stipulated. Thank you.
Thank you very much, IG. I think you have all heard for yourselves. I'm sure there are and there will be questions that you'll be asked regarding that issue. And I would also like to state that considering that this is the first day, there is likely to be some inconveniences that are going to be caused to people. They are regrettable but necessary. And I think that is important to point out in advance. The last item that I wanted to urge is that we as a government have decided that on this matter of coronavirus, there will be, in the medical area, there will be only one channel of communication. There will be no press conferences on the matter from any other quarter except this ministry. The reason being that we do not wish to cause confusion in the country and start double counting. For example, on the issue of announcing the numbers affected by the disease or otherwise, that can only be done from here. And you'll clearly understand why. For example, there was a situation where somebody talked about a student in the county. So that student had been one of the people who would have been announced in the first instance. But now it appears to be a second case, which is not the case. So we are urging CECs for health, our colleagues in county government governance, that please, matters connected with this issue, let's focus them in the Ministry of Health so that we can talk facts and we can clarify issues. For example, somebody might die of something else altogether, and the fact that they were in a hospital or quarantine seems like that is the case. Well, as a matter of fact, it may not be. So let's keep focused here. Finally, I am urging calm. Let's stay calm in the country. Let's keep praying because we are religious. We are religious people. But let's stay calm. Let's obey the law. There are those who will say that the police are going to arrest them or harass them. Why would you be arrested if you are at home? Why would you be harassed if you are at home? So the issue of being harassed or the issue of being arrested should not actually arise. You are at home. And I am sure, and the IG is here with me, I am sure no policeman is going to ask you to leave your home. On the contrary, they are going to ask you to stay in your house. So there shouldn't be much, there shouldn't be fear. The police are here to provide our security and obviously to ensure that the law is followed and the directives are followed. And for that matter, let's cooperate with the police. Thank you very much. Yes, Steve.
From Citizen, maybe from the IG, he hasn't told the police their do's and don'ts should they find members of the public on the wrong side, because members of the public are already worried that police officers might be preparing to take advantage, to even go to an extent of extorting members of the public. So what are the do's and don'ts for the police officers who will be implementing or enforcing the curfew from this evening?
Right, we'll take two or three and then we can respond. Yes. Sorry?
Kenyans would like to know maybe how the first up to the 31 question is doing, and then maybe after they say that we do have 31 confirmed cases. But then the other day you did say that we have one recovered case. So is the recovered person part of the 31, and then also the person who died yesterday is also part of the 31?
Okay.
And then also another question, maybe if they cite supermarkets as part of the essential services, what exactly are they going to serve beyond 7? What they will be serving part of the essential services?
Yeah, go on.
What is the plan in terms of delivery of justice for those who were arrested? Because this time we might remember that the courts are already.
That was my question about the courts. Perhaps there will be too many people who will be arrested. Will this be treated as the emergency cases that will be addressed by the court, plus the issue of the cases that we have? Yesterday, the death of that one patient at the Aga Khan Hospital. The other patients, how many are at the Mbagathi Hospital? And how many are in other hospitals, and which hospitals are these?
Okay, let me start and then I'll pass it on to the IG. But also repeat, okay, just not to speak for him, but to speak to the same thing I said. If you know that at 7 o'clock, if you are in the streets, you are going to be arrested, why in heaven's name would you be there? You know, so why create a problem for the police, as in they have to arrest you, they don't have to arrest you, they have to take you to court, they don't have to. Why are you creating that circumstance? If you stayed at home and as disciplined as you should be, you should stay at home, why would the question arise? You know, stay at home. The issue of all those things that you have said, Steve, they won't arise. So for me, I find the question very, I find it, anyway. As far as the supermarkets are concerned, obviously there is those people who are in essential services, and yes, they need to be served. And in any event, up to 7 o'clock, people are still going to supermarkets and buying whatever they want to buy. So that's why we decided that supermarkets, it's good to keep the supermarkets open. The issue of the numbers, let me clarify as follows. The total number of positive cases in Kenya is 31. The one person who died is among the 31. Okay? So in effect, there are 30 people who are alive. But the number of cases we have noticed in Kenya are 31. Case number 1 is still with us at Bagathi and doing well. But we cannot release anybody until and unless they test negative twice. So a person is tested negative, tested again negative, then that individual can be released. So I don't know whether that is very clear, that we are 31 in total. We have alive 30. We have released 1, but they are all 31 in total. I think the mathematics talks for itself. Yeah, I would like to invite the IG.
Thank you. Let me take this opportunity once again to assure Kenyans that once they stay at home, they will not be arrested. If you are a night shift, that demands you to be in workplace at night, report to your workplace before 7. Leave your workplace after 5. You'll have no problem with the police. However, police will be working in a multi-agency team. We have all other agencies involved in these operations. Just to mention a few, we'll be working with the Ministry of Health. We'll be working with the National Government Provincial officers, among others, that will provide accountability for the action of the officers, what they will be doing. On the issues where we arrest, what will happen, I've clearly said, we'll arraign the arrested people to court. How we'll do that one, leave it to me, but we'll work within the law. Thank you.
Yeah, thank you. You know the emergency numbers. We have not, as the IG said, the emergency number 719 is still operational. The ambulances, everybody is operational. So that would not affect anybody who is who turns out to be unwell, or somebody who is having challenges, health challenges. The number remains alive, 719, and the doctors are on call, and the ambulances are ready. So that should not be a problem at all. I want to thank you all once again, Asanteni, and please, please, please.
Last question to the IG. What is the plan on how to handle those who will be arrested? Already the police stations are usually crammed, just to ensure social distancing there. What's the plan? Plus, if I'm arrested, what fine will I face?
Maybe the last one also to Waziri now that gender. The United States has sent a tweet saying doctors who are willing to go and aid the U.S. in this COVID-19 pandemic can go to the embassy and get a visa facilitation. Is the ministry approving these? Will that affect the issuance of services to already in the country in need of the same?
Would you like to?
Yeah, I can.
That one is mine.
Thank you. I've assured the Kenyans, and I want to repeat, stay at home and you'll have no problem with the police. And I think that one is well understood. The issues, how I will deal with them when I arrest them, please leave it to me. I will work within the law. And also want to urge you, members of the state, we are among the essential services. but we only allow you to go to work and leave your office, go back to home, to your house. There will be no people. I'm not expecting to get you in the street. The law still applies, 7 to 5, but you must be on duty. I don't see any business for you carrying out coverage in the street, but on your way to your work and your way to your house, you are good. We'll support you, we'll escort you if you wishes, but please let us give ourselves each one its territory to dominate. Thank you.
Endelea ndugu. As I said, it's a police matter. I will leave it to the police. On USA, asking us, normally what would happen is that if governments need help, these matters are handled on the basis of government to government. Government to government. We will not be releasing any of our doctors to the US because we need them here. That's number one. Number two, we have even recorded, our doctors who are on leave to come and join us. And if a request were to come, from among friends, because we are all friends, if a request were to come and the ability was there to help, we will do it on the basis of government to government. So we will not be, there will not be individual moves. The second issue is that even we might need help at some point, and therefore we are also going to be talking to our friends to see. This is an international issue. There is nobody who is superior, and there is nobody who is inferior in this disease. There is nobody who is rich and nobody who is poor. It makes very little difference how much you have in your bank account. So we will respect each other and work on government to government basis. Thank you very much indeed. I would also like to finally thank again our frontline soldiers, our laboratory technicians and lab managers, our nurses here represented by Dr. Nandili, who is with us here today. Karibu sana daktari. Please tell nurses we really appreciate what they are doing, and we continue to train, we continue to protect and ensure that our doctors, our nurses, our technicians and our clinicians do not suffer from this disease. Thank you all very much indeed.